Hey everyone, welcome back to my channel. Today I'm going through another case study example and questions for the NCMHCE. In today's case study, our client's name is Marcus Rivera. He's 16 and identifies as male and Latino. He's in 11th grade and he's come to us because he was referred by the Juvenile Diversion Program after a marijuana possession citation. Marcus presents to therapy with his mother following a court-mandated referral after being cited for possession of marijuana at school. He appears guarded and states, "I'm only here because I have to be." He minimizes his use, saying, "It's just weed, everyone does it." His mother reports a complete change in attitude over the past 6 months. Marcus has become defiant, secretive, and disengaged from school. She also notes he's been skipping classes, has dropped out of soccer, and has been hanging out with a new crowd. Marcus denies using any other substances but admits to smoking pretty much every day and drinking alcohol on weekends. He insists it helps him calm down and sleep. He denies suicidal ideation or self-harm. Marcus lives with his mother and younger sister. His father has been incarcerated for the past 3 years. His mother reports working full-time and feeling overwhelmed. Marcus reports a strained relationship with both parents and says he's on his own most of the time. He has a few minor disciplinary infractions from school, mostly for tardiness and disrespectful behavior. He's not currently failing classes, but is at risk due to poor attendance. Here's what the mental status exam says. His appearance was casual, slightly disheveled. His attitude was guarded and defiant. His mood, and this is a client quote, fine. His affect was restricted. His thought process was logical. His thought content did not include any delusions or suicidal ideation. His insight was poor. His judgment was impaired regarding substance use, but he was oriented to person, place, time, and event. So here's our initial provisional diagnosis. F1220, cannabis use disorder, moderate. Z63.8, parent-child relational problem. Z60.5, target of perceived adverse discrimination or persecution. And we want to rule out conduct disorder, adolescent onset type. What areas would be most important to assess during the first few sessions? Select all that apply. A, detailed substance use history, including onset, frequency, and type. B, peer influences and social environment. C, history of trauma or exposure to violence. D, Marcus's academic goals and extracurricular interests. E, current sleep hygiene and nutrition habits. And F, past psychiatric hospitalizations. And the answers are A, B, C, and D. The rationale behind this is substance use patterns, peer influence, trauma exposure, and school engagement are highly relevant. Sleep and nutrition and hospitalization history may be important later, but are not top priorities for this case. Which of the following would be the most appropriate clinical goal for Marcus early in treatment? Select just one. A, gain full abstinence from all substances immediately. B, improve communication with his mother. C, identify internal and external triggers for use. Or D, increase empathy for how his actions impact others. And the answer is C. The rationale behind this is understanding triggers is a foundational harm reduction and CBT-informed goal. Abstinence may be a long-term goal. Improving family communication, which was B, and empathy, D, are important but secondary at this stage. Which standardized assessments would be most appropriate to administer? Select all that apply. A, the CRA-FFT substance use screening tool. B, the Adolescent Drug Involvement Scale, ADIS. C, the Beck Depression Inventory, BDI-2. D, the Columbia Suicide Severity Rating Scale, the CSSRS. And E, Structured Interview for Conduct Disorder. And the answers are A, B, and E. The rationale behind this is the CRA-FFT and the ADIS are validated tools for adolescent substance use. A conduct disorder screener is relevant based on behavioral patterns. Remember, we're trying to rule that out. C and D may be useful if depression or suicidality are suspected, but were not indicated. Which intervention would be most appropriate for Marcus at this point in treatment? Select just one. A, motivational interviewing techniques to enhance insight. B, trauma-focused CBT to process childhood experiences. C, in-depth exploration of his father's incarceration. Or D, family therapy with a focus on his sister's perspective. And the answer is A. Marcus lacks insight and motivation. Motivational interviewing, you'll see it abbreviated MI, is the best match for adolescents with substance use and resistance to treatment. Trauma and family dynamics may be relevant later. Which of the following treatment interventions would be most helpful in supporting Marcus's progress? Select all that apply. A, CBT-based relapse prevention strategies. B, parent coaching for monitoring and limit setting. C, referral to a peer-led recovery support group for teens. D, psychoeducation on legal and health consequences of cannabis. Or E, journaling to explore feelings of abandonment by his father. And the answers are A, B, C, and D. CBT, parental involvement, peer recovery support, and education about risks are all core to adolescent substance use treatment. Journaling may help long-term, but it is not a primary early-stage intervention. Last question of the day. Which referrals or supports would be most appropriate to consider for Marcus? Select all that apply. A, school-based mental health or substance use counselor. B, family systems therapist. C, intensive outpatient program, IOP. D, probation officer for increased monitoring. And E, after-school mentorship program. And the answers are A, C, and E. School support, structured outpatient care, and mentorship can promote stabilization. A family systems therapist could be useful, but it's not the most immediate need. Probation oversight isn't necessary unless there's escalating legal involvement. And that's it for today. Please comment below to let me know how you did on these practice questions and what you think about them. If you found this resource helpful, please hit the like button and consider subscribing to my channel. Lastly, if you have a friend or classmate who would also benefit from watching this video, please share that with them. As you'll notice, my channel is pretty small, so shares go a very long way. Best of luck on your study journey.